Today is Thursday, January 17th, 2019. I'm interviewing Dr. Mason as part of the Oral History Project, CDC's Early Response to AIDS. Welcome to the project, Dr. Mason, and thank you for being here today. Do I have your permission to interview you and to record this interview?
Yes, you do.
Dr. Mason, typically these conversations begin with questions about one's background and training and the like. But in the interview that you did for the polio chapter of the Global Health Chronicles, you spoke at length about this, including your time as an EIS officer, class of 1959, and your selection as CDC's 11th director. So today I'd like to focus more on your time as CDC Director and Assistant Secretary for Health. And as such, you were part of some pivotal events in the early history of the AIDS epidemic. So let me try and set the scene. You arrived in Atlanta, December 1983, to begin the job of the CDC directorship. And at that point in time, with respect to the AIDS epidemic, a little more than 3,000 cases and nearly 1,300 deaths had been reported in the U.S. And although epidemiologic studies had worked out the modes of transmission, there was still a lot of fear among the public about transmission by casual contact, food, insects, and the like. And in May of 1983, scientists from the Pasteur Institute in Paris had reported the discovery of a retrovirus that they described as being the possible cause of AIDS. So I want to ask, when you were interviewed for the position of CDC Director by Health and Human Services Secretary Margaret Heckler and others in Washington, do you recall if the topic of AIDS came up during your interviews or discussions?
You know, I don't really remember, but I'm sure some mention of it was made. It was just too much front and center at that time not to have said something about it.
Yes, already it was some 2.5 years since that initial MMWR had come up. So maybe set AIDS aside for just a moment or two. What were your thoughts when you arrived at CDC to take the helm about CDC's overall priorities? What was your vision for where you thought the agency should go?
I felt that CDC needed to certainly pursue AIDS. It was of concern nationally, internationally, and it had been concern to me as the director of the Utah Department of Health, so we were heavily involved with AIDS. So there's no question about AIDS being a problem. But I'd been on several CDC committees while serving as director of the Utah Department of Health, and I had been pushing pretty hard on some of those committees for CDC to broaden its base. It originally was the Communicable Disease Center and then the Center for Disease Control. And I felt that the skills and the expertise that CDC had that had enabled it to become front and center, recognized internationally on communicable disease control, should be moved into some of the other killers and cripplers of that time. So at that time I'd been working very closely with Bill Foege, trying to emphasize chronic disease control. We were worried about injuries. There were other problems that weren't being addressed. There were other federal entities that were working with them, but lead poisoning and mercury, and there were concerns about amalgam in dentistry where they were using mercury, and there just hadn't been established a good science base in toxicology. The Agency for Toxic Substance and Disease Registry had just been organized at CDC, but it was small, and it didn't have the capacity that would be needed for it to get into and contribute what it had the skills to do. So I saw pursuing communicable disease problems and AIDS, but a need to really expand the scope of CDC's responsibilities.
What was it like trying to balance AIDS with these other responsibilities and priorities that you felt certainly were coming of age and needed to be addressed?
It was very difficult. This was the Reagan administration. The Reagan administration particularly had been concerned about the United States government running a budget deficit, and they wanted to balance the budget, and so budgets were being cut. So here I arrive and realize that we don't even have adequate resources to pursue the AIDS epidemic, and I want to expand it into other areas that in the long run would not only increase the quality of life of Americans, but would reduce the costs of medical care. And so it was a real challenge to arrive at that point in time when I felt growth and putting adequate resources was important, and those that had brought me there at the top were looking at downsizing.
Well, how did you go about tackling this? What tools or approaches does a CDC director have to try and get funding and FTEs to staff up, not just for AIDS, but some of these other important issues of the day?
Well, I refused to accept that the only way we could handle AIDS was by diverting money from other important programs. And I expressed that at that time. Margaret Heckler was the secretary, and those in power in Washington, I let them know that there was no way I could support a diversion of resources because the other programs were important in their own right, and we had to have additional funds for AIDS. I just come from Utah. We didn't have funds to pursue AIDS control activities here at the state level. None of the 50 state health departments had the resources to really optimize what needed to be done to control the spread of AIDS. And so not only did we need more money in-house at CDC, but there needed to be provision of resources for health departments at the state and community level if we were going to get the epidemic under control.
And CDC was often the conduit to get money out to state and local health departments.
CDC was really the only conduit that you could use to control disease of any kind. We're talking about whether it's diphtheria or whether it's a chronic disease. If any money came to the states to enable them to staff up and carry out a effective program, if it came, it would have to come through CDC. None of the other PHS agencies really had that link, nor did they have the expertise nor the interest.
So you mentioned Secretary Heckler, and then you also worked with her successor, Secretary Bowen, Otis Bowen. What was their reaction? Were they supportive? Were they helpful? How did you try and get through this impasse in terms of the administration, the Reagan White House?
Well, whether it was Margaret Heckler or Dr. Otis R. Bowen, they were not permitted to provide us with the resources. And I told them both that I would try to be supportive, but if when I went, CDC had hearings, budget hearings, before the House of Representatives and the Senate. And I said, I'm not going to tell stories. If they ask me what kind of resources we need, I'm going to be absolutely honest and tell them what I feel is necessary for us to succeed, not only in taking care of the AIDS problem, but maintaining other programs that needed to be maintained, and that ultimately we'd need to expand this if we were going to bring chronic and communicable diseases under control.
Now that's kind of a radical thing to do, because traditionally within an administration, you're supposed to, I guess, toe the line in terms of what the White House wants vis-a-vis budget and whatever. So did you face any repercussions for being truthful in the resources?
I felt that those people that I reported to were supportive of that attitude. In other words, what choice did I have? I wasn't going to tell Congress that we had plenty if we didn't have enough. And you know, your own personal integrity, and you don't have to work for the federal government. There are other things a person can do.
Was Congress sympathetic? Did you have some sympathetic supporters? I imagine it was a bit of a mix.
You know, I never had anyone call me on the carpet. I think most people supported what I was doing. And in discussions, I spent a lot of time in the White House. First because Margaret Heckler had no medical background and needed some backstopping, and so I probably spent more time in the White House than most of my predecessors had, simply because of the situation I found myself in. And then later with Dr. Bowen, the AIDS epidemic was front and center, and I was often asked to go there with him with regard to AIDS and things of that nature. And even when I answered President Reagan's questions on several occasions. On one occasion, Vice President George Bush asked me to come back into his office and discuss things, and I felt that if you could get to them beyond their staff and let them know what opportunities existed and how important it was to exploit those opportunities, I never had any criticism from them either.
So eventually, increased funding was appropriated for CDC
Yes,
and
we
the other
were
PHS agencies.
Not largely successful, but bit by bit we began to get the funds we needed, not only for in-house CDC activities, but we began diverting funds that, well, they were appropriated by Congress for use in the states and municipalities.
What do you think turned the tide, at least in terms of the increased appropriations? Certainly, it sounds like you were really persistent in trying to bring people's attention to the needs.
You know, I'm not sure the tide ever turned. It just, it was a continual battle that just had to be ongoing. It wasn't, we win this and everything goes well. You won each year's appropriation. This occurred annually, and you had to fight for what you got each year.
So that's kind of an exhausting sort of thing. But CDC was not alone in this. I presume NIH, FDA were in the same position?
Absolutely.
All of you battling there for your funds. Let me switch a little bit to another topic. I had mentioned a few moments ago in talking about events that had transpired that the Pasteur Institute had reported the discovery of this new virus that they called lymphadenopathy virus, or LAV. And it was about a year later, in April of 1984, that Secretary Heckler announced that Dr. Robert Gallo from the National Institutes of Health and his colleagues had isolated a virus that they named HTLV-3. And they provided a lot of data to support that HTLV-3 was the definitive cause of AIDS. The day before the press conference, the New York Times ran a front page story in its Sunday April 22nd edition, and it featured your photo and an interview with you. And the story read in part, and I quote, "Dr. James O. Mason, head of the Federal Centers for Disease Control, said today that he believed a virus discovered in France was the cause of acquired immune deficiency syndrome, or AIDS. Quote, I believe we have the cause of AIDS, and it's an exciting discovery," Dr. Mason, who is a virologist, said in an interview. "The public needs to know that this is a breakthrough and that it is significant," end quote. So I was wondering if you could tell us a little bit about the backstory about all of this. How is it that your views sort of preempted in some ways Secretary Heckler and Bob Gallo's announcement that happened the very next day? Did you know that they were about to announce the findings from the NIH scientists?
That was a very difficult episode in my career.
I bet.
Some months before, the French scientists had visited CDC and had shared with us their work. And actually they had held several meetings and had announced that those activities had been carried on. I didn't know that Bob Gallo, and I have the greatest regard for Dr. Gallo and the NIH people, but and we had been supplying NIH with specimens, and we were working quite closely with them, but I would say that most of the activities we were inputting them, and they weren't telling us much about what they were finding, but they were very dependent upon us for specimens and epidemiological data. So we didn't know where they were, but we knew where the French were. And a week before this announcement, a top medical reporter for the New York Times had been visiting CDC, and during our discussion, I knew him personally. I told him that he ought to, when he asked a question about when will the virus be isolated, I said it's already been isolated, and quoted what had been stated by the French in their meetings. And I advised him to get in touch with the French if he wanted to know more. Well, he knew he had plenty of time, or thought he had plenty of time, and then on that weekend that you were talking about, a week later, there was an announcement made that there would, first it was going to be a press conference on Friday, and then since Margaret Heckler was not in town, it was postponed to Monday. So by then everyone knew something big was happening, and New York Times got wind that it would be an announcement about the AIDS virus isolation at NIH. So they just went back to my interview a week earlier and put it in the Sunday New York Times the day before Margaret Heckler and Ed Brand and Bob Gallo's announcement.
So I imagine they read the New York Times in Washington, D.C.
Oh, yes, they did, because they called me, and they were very upset.
Did you think you might be fired over this?
I didn't care, because my motives were the best, and what I said I knew was right.
Well, it's interesting that you in your comments that you note that there clearly wasn't a lot of information sharing that was going on between NIH, at least in this regard.
And that was the whole problem, because I could have protected both the secretary and NIH people had we known where they were. And later, as it turned out, years later, that the virus that Gallo had isolated was the French virus. So it all came together. But they called me, they were very upset, told me what they were going to do, and I told them that it would be a mistake, because not only were they going to claim that NIH had isolated the virus first, but Margaret Heckler decided that she was going to announce that we'd have a vaccine within a year and make some other statements, And I said, hold the press conference, but we won't have a vaccine within a year. And give the French some credit. What Bob Gallo has done is wonderful and it's worth noting, but make an announcement where we have discovered these things and French have done this and put this all together, and it's a great advance. But it
didn't turn out that way.
it didn't quite turn out that way.
We're still looking for the vaccine.
We still are looking.
Did this have any long-lasting effects on your relationship with the secretary or others?
It had a long-lasting effect, and it was very positive. They asked me to get on a plane and come up for the press conference, and I hadn't talked to the secretary. I had talked to one of her people, but before her announcement, I did have an opportunity to talk to her, and I told her the same things. Don't promise a vaccine. Give the French some credit. Look upon this as a partnership. And her advisors counseled her to go ahead, and she did, and she just got hammered. And as a result of that, a relationship between Secretary Heckler and I became very close from that point on, because she saw that everything I advised her to do was what she should have done, not what she did do. And so before she made any other statements, in fact, she never went to the White House after that unless I went with her. So yes, it did have a long-term relationship, and I have to give her credit rather than just be, she was angry when I was advising her not to do what she was planning to do, but she was very friendly from that point on, because I think she felt that I would tell her what was appropriate.
Well, as testimony to that, in February of 1985, some 15 months after you started as CDC director, you were asked to take on the role of acting Assistant Secretary of Health, as Dr. Ed Brandt was stepping down from the position. So I guess that is a good indication that you were held in high esteem.
I guess so. And I enjoyed working with her. She was a marvelous woman. I think it would be very difficult to be Secretary of Health and Human Services without any health-related background, just to be thrown into that, and then you're surrounded with political people. She had no science background, and so she really needed someone with a science background that she could rely on. And I think she felt that I could keep her from, there were other areas where she knew far more than I did, but AIDS and things of that nature, I think she realized that it would be wise to at least listen to me.
So when you went up to Washington to take on this acting Assistant Secretary for Health position, there's a myriad of agencies that are working on AIDS. There's CDC, there's FDA, there's NIH, Alcohol, Drug Abuse, and Mental Health Administration. Can you talk a little bit about the relationships among the agencies with respect to the early response to AIDS? When you got up there, what did you find that was working well and not so well?
All of those agencies reported directly to the Assistant Secretary for Health. Today in Health and Human Services, they all report to the Secretary. So there was a powerful relationship between the ASH and the agency heads. I had gotten to know them because there were frequent agency heads meeting in Washington, and sometimes weekly, sometimes every other week. We all met together, so I knew them all, and now I was, so to speak, their chairman, and we established a second meeting. Not only was there an agency heads meeting, but there was the weekly AIDS Coordinating Council. And the agency heads were wonderful, cooperative. I was very fortunate to be working with men and women who were willing to work with me and support me, and I think we were able to at least improve coordination and communication between the agencies during that year I was there. And when Bob Wyndham came, he continued with those meetings that had been set up, and although coordination wasn't perfect, I think there was pretty good coordination between the agencies during the period of time I was there, and I felt they were loyal and qualified and were working hard to get the epidemic under control.
Did you have to deal with any turf battles between the agencies about overlapping or perceived overlapping responsibilities? Was that something that was a problem?
Not really, because although the main duplication was between NIH and CDC. Now, CDC had control, epidemic investigation. They were out across the nation. CDC is primarily research, basic research and
NIH.
applied research.
NIH is basic.
NIH. Thank you for that correction. And the overlap was CDC had virological laboratories and NIH had the same, but what one was basic research, while the other was applied research, and what was needed was just good communication between the two organizations. I think when they carried out their roles together, there was great strength. And in other areas, HRSA had a different responsibility. There really wasn't a lot of overlap between the agencies.
While you were acting, Ash, the first public health service plan for the prevention and control of AIDS was developed in 1985. Can you talk about that? How did that come about? What did it take to make that happen?
Well, to my memory, CDC had plans, goals, objectives, what needed to be done, and that was the basis for our budgeting. And there had never been a plan put together agency by agency, taking into consideration the responsibility, the different responsibility of each agency. So in those AIDS coordinating meetings on a weekly basis with agency heads, and then they brought with them the person or persons that were directly involved with AIDS, that enabled a plan to be put together that encompassed not just CDC, but for all of the public health service agencies, what each contributed, and that was the basis for budgeting.
It's interesting, when I was preparing for this interview, I came across a New York Times editorial from August of 1985, so about the time, I guess, that this plan came out, and it read in part, quote, James Mason, as acting Assistant Secretary for Health, developed a plan of action and persuaded the administration to raise its AIDS budget by 40% instead of reducing it by 10% as was proposed. So it sounds like the plan had an impact.
That's what a plan will do. If you can put down your plan and you justify, and that I think is really the basis of good budgeting. What are you going to accomplish and why does it need to be done? What happens if it doesn't get done? And then people can put a price tag on it that really went up to the secretary and then to those that are responsible for management and budget.
So you were acting assistant secretary for less than a year, and I came back to Atlanta in December of 1985, I think coincident with Secretary Heckler leaving as Secretary of Health and moving on to another position.
When I saw an opportunity to leave and get back, I didn't spend much time with my family for that year.
You were commuting.
I put my deputy largely in charge of CDC, but I'd spend time at CDC on Monday and then get on a plane and fly to Washington and come back then Friday or Saturday, and it was not a good time for family life and things of that nature. And with the change of secretaries, and by then they had begun recruiting a full-time Assistant Secretary for Health. Bob Wyndham was in the wings, and this was my time to disappear.
So it felt good to be back in Atlanta.
I could have stayed as Assistant Secretary for Health, but my whole life has sort of been wrapped around periods of 5 years in a position. Not necessarily.
Because you had barely started getting things going as CDC director when you were uprooted.
That's right, and I wanted to come back to CDC because I'd really done CDC a year, and then after that second year, that's 2, I still got 3 years where I want to accomplish something, and the developments, the National Center for Health Statistics, chronic disease, injury control, building up a response to toxic substances. This wasn't done. I still had a job to do back in Atlanta.
Well, as much as I would like to talk to you about some of those other topics, we're going to have to stay on track a little bit with AIDS. So I wanted to move to this area of AIDS information and education, because this was an area that I know you had a lot of involvement in. So in 1987, saw the launch of 2 important activities in this arena. Firstly, CDC established the National AIDS Clearinghouse to distribute printed materials on AIDS. And secondly, the America Responds to AIDS campaign began. And the campaign, among other things, included the development and distribution of public service announcements for television and radio networks across the country. So just to get us started, why were these initiatives needed? It's 1987, so we're 6 years, almost 6 years out from the first MMWR publication about these cases of AIDS. What sort of information was CDC trying to or information gaps was CDC trying to address?
We were tracking the epidemic quite well by then, and it was clear that the message as to how to prevent the transmission of AIDS had not gotten out. And there's a number of reasons for that. It's hard to get health messages out. The whole field of public health, how do you tell people? Look at today, people are obese. All of the things that people violate, they don't understand, even though we've been working for 20, 30 years to try to get the message out. But we didn't have 20 or 30 years for AIDS. And so even though Public Health Service and the federal government had organizations that did health communication, we went out to some of the best people on Madison Avenue, and by now we had enough funds that we could interact and communicate with them and even pay for their services. And so we were now able to interact with top-notch communications people in the field of television and radio, printed material, something that the government had never had in the health field. And we felt that by involving committees, bringing those people that were at risk for AIDS, gays, lesbians, drug abusers, in other words, how do we bring the people where AIDS is still being transmitted and get them all together so that the American public begins to really understand how it's spread and how it isn't spread. At that point in time, most of the people in the United States felt that casual contact would allow AIDS to be spread. We were hearing all the time that mosquito-borne AIDS, well, AIDS was never spread by casual contact. It was never spread by mosquitoes. look, when we put the guideline up, that kids with hemophilia that had become infected with the AIDS virus through the clotting factors, we put out guidelines that it was safe for them to attend school, and that we were lambasted by op-eds and the general public. People were scared to death. They wouldn't let their kids go to school with someone who was HIV positive, even though you don't communicate AIDS between children close. We'd done epidemiological studies where we had looked at homes where there were people positive for AIDS, kids playing with each other and sleeping in the same bed in Africa and other places. You don't spread it in the household. And this was an opportunity to get a message that hadn't gotten out in a professional way using tools that public health has never used before.
So a couple of key things. It sounds like the bringing on board of a professional advertising public relations firm. I think it was Ogilvy and Mather, was it?
That's correct.
And then it also sounds like you. There was a concerted effort to include in the development process the affected communities, as you said. That were they part of assisting you in the development or testing of these advertisements?
Absolutely. And in fact, we even funded some of the gay and lesbian organizations to produce their own videos and teaching tools. Because, first of all, I wouldn't feel comfortable putting my name on some of the stuff that went out, and government wouldn't and shouldn't, but it allowed them to communicate in a way that we can't do. And that's one thing that I really learned, that when a person is sick, it doesn't matter, they need help. And if there's one thing that I learned from the AIDS epidemic, was to appreciate people that may have behaviors that are different than mine, but nevertheless they're sick or they're going to get sick, and I had a responsibility to do something about it.
So you had some real interactions then with the various advocacy groups that were springing up at that time.
We had to if we were to succeed.
And if it was going to, I guess, be considered credible in terms of its messaging. So the challenge is to come up with, in these various information campaign approaches, factually correct information that can be understood by the general public. But it's the material, this information, it touched on subjects, sex, drugs, and the like, that were certainly fairly controversial. And I'm assuming that you had to get clearances from levels within the Public Health Service, from the White House. Can you describe some of the challenges that maybe you encountered in getting approvals for some of these campaign or materials?
We did have problems, and I can understand their views. It isn't until you get down in the trenches and begin interacting with the people that are infected or likely to get infected that you really understand what has to be done if we're going to stop this epidemic. And so I don't want to criticize them, because probably if I'd been in their position with their contacts and background, I might have been exactly as they were. But this was a little bold for federal government, and we just felt that we had to go there. And I don't know how we would have accomplished what needed to be accomplished without being there and going there. And it was controversial, and in some instances I was never able to get approval. And when we recommended that a brochure be mailed out to every household in the United States, we never got approval for that. And we just did it. And Congress aided and abetting, because they appropriated $25 million, and $25 million isn't much money now, but then it was a lot of money. and that was our budget for the AIDS mail-out. And when that money was appropriated, the Congress put on the appropriation that the content of what would be mailed out would be approved by the director of CDC. Well, that probably is unconstitutional, and it was never challenged, but I was told by the White House that I couldn't put out a brochure, and I did it anyway.
So this is the Understanding AIDS brochure, the brochure that was
Yes.
mailed to every household in America. And I think the original plan, if I have this straight, was for CDC to develop and distribute this brochure in October of 1987. I think you wanted it to come out coincident with National AIDS Month. And that, when you say it was never approved, it was that initial time frame that you were never able to meet because of the pushback that you were getting?
We had neither money appropriated to do it, nor did we have the go-ahead. But I couldn't give up.
What were people in the administration? I know the Domestic Policy Council was an entity that you interacted with pretty regularly. What were their issues? What were their fears or concerns? What was so upsetting to them about putting out science-based information?
I never heard from President Reagan or Vice President Bush any personal concern about anything in the brochure. I'm not sure they were that close to it, but I had all sorts of problems with White House staff. And they tend to be more politically inclined. Facts, scientific fact, or a week the brochure is all printed, is ready to mail out. I'm still getting calls from White House staff. For example, the brochure says you won't get AIDS from a kiss. And they were arguing with me that we were wrong about that. We were going to infect the whole nation with the message that was contained in the brochure. They were still worried about casual contact. They were still worried about transmission by mosquitoes. They were worried about some of the wording we used in the brochure that went out to every household. And yet I felt it was a brochure that if my teenage or younger children read, that no one would be offended or misled in any way. It was just frank, and it was science-based, and we weren't going to let politics or social life contaminate that mail-out.
So it was actually that appropriation language which also gave you the money to have CDC develop and distribute this brochure. That was really what allowed this to go forward then.
That's right, and the wording I could have been challenged, and the threat of a challenge was only invoked within the week or two of actual mail-out. It was already printed, and there was no way to stop it.
Tell us how, can you tell us a little bit about the involvement of Surgeon General Koop in the brochure? Because I think it was the front page of the brochure featured a message in his photograph. How was it that he came to be involved in the Understanding AIDS mail-out?
I worked very closely with C. Everett Koop, a marvelous person, and he, I think of all the Surgeon Generals that I've known of, through his work on tobacco and other programs that he took, he became, people probably recognized his picture and name more than they did the President of the United States for a period of time. And so as we designed the brochure, working with Ogilvy and Mather, we wanted to put on the front the most prominent person to get the attention and who had the confidence of the people of the United States. And we identified that person at that point in time as being C. Everett Koop. In other words, this was just who is going to look authoritative, believable, and someone that they're willing to put themselves behind. So he was chosen because of what he was. He, so in the design of the brochure, he reviewed drafts of it. I was the one that invited him to, please, can we feature you on the front page? And he was quite willing to allow his name and picture to be used in that brochure.
He had previously, there was it called the Surgeon General's Report on AIDS. There had been a report that had come out under his name prior to the brochure that I think was a little bit more technical. So you're right, and certainly wearing the uniform of the Public Health Service, he had kind of a very, not authoritative, but I guess, as you said, believable. People believed in their Surgeon General. If he said it, must be true.
And that's why he was chosen. You notice Bob Wyndham, the Assistant Secretary for Health, Otis R. Bowen, their names were down at the bottom, and it was a bit sensitive, telling them that we felt the picture of Surgeon General Coop would be the strongest way to get this message out, and they took it well.
So this is a big undertaking. I don't think it has been done prior to this time to contemplate sending out a brochure through the U.S. Postal Service to every household in America. Can you give us a little bit of insight into the level of detail in terms of planning to make this happen? Because you were really sort of leading and coordinating this, correctly?
That's
from
right.
CDC. So how did you go about making sure that this happened, and it happened on time, because you had a deadline to do this?
Well, first of all, I had a lot of good people I was working with. I had Dr. Don Hopkins, who was my deputy director. I had Jim Curran, who was heading AIDS at CDC at that time. I had Gary Noble, who was a deputy for science, and I just can't begin to describe the depth of people that were not just good scientists, but just people that very capable, and without that kind of backstopping and help, but it allowed me to make sure that we were dealing with the best outside of CDC, like Ogilvy and Mather, and someone had to sort of be the front of, in other words, I couldn't expect other people in the organization to go against what was happening at levels in Washington that was slowing this down and going against it, and that's where I spent most of my time, is coordinating it, making sure we had a good plan. I had confidence in Ogilvy and Mather, and I think it was worth all the trouble, and with the help of so many people, it was something we could do. And you know, I had a lot of support from Dr. Bowen, Newman, who was the deputy secretary. I've got a block. His last name was Newman, who was deputy secretary of health. Others really got behind, and no one up there were antagonistic. They were supportive, and they were helpful. So I had help all the way, and the only place I really took difficulty was from staffers in the White House.
Did you, was there any attempt to get a sense of what the impact of the brochure was? Were you able to get a sense of the proportion of people that actually read it, or if there were upticks in requests for information and the like?
Part of our funding was for a very extensive evaluation of the impact of that reading, but more important than reading was their change in behavior. And as I recall, the review was very favorable. And I think even more important than the review, it was about 1988 where the number of new infections in the United States began to decline, and we can't ascribe all of it to this. But I think it was well worth the time and the effort and the expense.
I want to talk about another event that occurred around this time. It was in 1987, and it was in May of that year that the Public Health Service added HIV to its list of, quote, dangerous contagious diseases. And as a result of this, immigrants, people, either tourists or people seeking to live in the United States, were going to be required to be HIV tested, and if found to be positive, would be prohibited from coming to the United States. Firstly, can you tell us a little bit about what is the dangerous contagious disease list? And then secondly, what was the thinking about adding HIV to the list?
The list includes syphilis, gonorrhea, and I've forgotten the other disease.
TB, active TB, I think.
And tuberculosis. And everyone who's going to immigrate, whether it's long-term or short-term, has to be tested for those diseases. Well, there was a recommendation that AIDS, HIV infection not be added to the list. And I took a very unpopular point of view that from a science standpoint, if you put syphilis and gonorrhea on the list, if it's on the list legally, how can you not put AIDS? I said, I understand the problem and I detest the discrimination that occurs when people are listed as HIV positive, but I said as a scientist, this is a so-called scientific list, and for me to say AIDS when I'm telling people that it's a killer, and then it doesn't deserve to be on a list of dangerous contagious diseases, I said, I think as far as I'm concerned, we either take syphilis and gonorrhea off or get rid of the list altogether, or if you can't take syphilis, gonorrhea, and tuberculosis off, then you have no choice from a science standpoint of putting HIV and AIDS on. And there were a lot of people that didn't agree with me, not with my science, but for the effect. But I said, take all of the, and that was my position, and it was the position that held with the Secretary and the White House.
So there was no appetite to consider your other option of removing syphilis and gonorrhea?
And the list, they were put on the list by Congress.
Oh, okay.
And there's no way that Congress would have taken those two off the list. And I just didn't see how I could, as a person that was looking more at science than social and political, I didn't want to cross that line, because if you cross it there, then where else are you willing to cross it?
And it came back, this inclusion of HIV, AIDS, and then HIV on the list sort of cycled back a couple of times in subsequent presidencies, the George H.W. Bush and the Clinton presidencies. There were various, Congress deliberated about this again, and some of this, I think, occurred when you were the Assistant Secretary for Health. Were you ever drawn back into this discussion again when Congress was revisiting these issues in later years?
I'm going on a very faulty memory as to this specifically, but I know that there was a discussion in the White House, and as my memory best serves me, that this issue came up, and Vice President Bush recommended that HIV and AIDS not be put on the list, and I was the junior member in the Roosevelt room in the White House and had not planned to say anything. In fact, I didn't think it would be appropriate. But when they got into this, I finally raised my hand and was recognized by the president. And then I said exactly what I said just a few minutes ago as to why I can't recommend it as scientifically. And after that meeting, Vice President Bush asked me to come back into his office, and we had a long talk. This was not too many months before he ran for president, and he just said, "I appreciated your expressing yourself about the issue, and I have changed my mind."
So you found yourself in disagreement with, I'm presuming, some of CDC's HIV scientists, epidemiologists, about this decision to add it onto the list. You alluded to that. You said it was unpopular, or...
Well, it was very difficult, and it was difficult, I think, even for people with science backgrounds, because they were aware of the discrimination. As soon as you turned up to be HIV positive in a test, then there was definite discrimination. And that was the hard part for me, because I knew what it would do, and yet I just felt...
Sounds like you felt like you were boxed into a corner almost because of how the construct of aligning it with syphilis, gonorrhea.
How can you call those dangerous and contagious diseases and not put this other one on it?
Eventually it did get taken off the list. I guess we should add for the record, in 2010, I think it was, during the Obama administration, it was removed from the list. Well, let's move on to recommendations, guidelines. You talked a little bit about this as well. This is another one of CDC's key responsibilities, either alone or as part of the Public Health Service, to develop HIV-related guidelines and recommendations. And a lot of these were controversial. Oftentimes CDC was being tasked with developing a guideline when there was extremely limited data to try and support recommendations. And you mentioned the development of the CDC guidance as related to HIV-infected school children, daycare centers, very unpopular. You said CDC came out in its guidance and said for children that had no overt medical problems or whatever, there was no reason that they should be excluded from school. Another one that I think was controversial in its day was when HIV testing became available. In 1985, 1986, it's now possible, initially for blood banks, but then individuals, to be able to be tested for HIV. And so the question arises, well, who should be tested? How should they be tested? And so CDC and the Public Health Service put out guidelines in August of 1987. Can you talk a little bit about the issues that were debated around the development of testing guidelines? Because there were differing views about the voluntary nature of the testing, who should be tested, what would be the repercussions for individuals that were found to be positive. So can you talk a little bit about the development of those guidelines and some of the...
As to the best of my memory, first of all, I would just like to say in this context that there was no treatment for AIDS at that time.
Good point.
Which is very significant. But there were people who felt that everyone should be tested and that those who were positive for HIV should be quarantined.
So that's a pretty hot topic right there. Yeah.
It is, and that was a political point of view on the part of some. I felt that, well, first of all, I don't believe in a free country that you mandate that anyone be tested. I think that takes away a basic constitutional freedom. No matter how good it would have been for someone, just in a free nation, do you require people to be tested? So that is constitutional. But I knew that if we mandated testing, if anyone mandated it, that the people that most needed to be tested would defer and they would find a way. In other words, even if you did want to mandatorily test everyone, or even mandatorily test everyone that you suspected might be HIV, how would you round them up and get them tested? And the best we could do would be to make it so safe so that people who thought they might be HIV positive would feel comfortable and safe in coming in and being tested. And so the big controversy was mandatory or let people come in and feel safe that as a result of your coming in, we can treat you to the best of our ability to treat you, and we can help you so that you won't spread your disease to your sexual partners or those that you're injecting IV drugs with. And thank goodness that philosophy prevailed.
Because you had some battles, I presume, with
It
the
was
White
a
House,
battle.
with some members of Congress.
And this is where my memory, because it may have been that issue rather than the issue before where I went back to talk with Vice President Bush, because it was on one of, and it's more likely to be this one where he spoke for mandatory, but I'm not quite sure.
Okay.
One or the other. He spoke on one, but after expressing myself, the whole spirit of the discussion changed.
And as you said, the ultimate outcome, the guidelines that were published in August '87, by and large recommended offering, but not mandating, counseling and testing in a variety of settings, typically where high-risk populations might encounter providers, IV drug clinics, sexually transmitted disease clinics, and emphasized also, as you said, the importance of confidentiality and the prevention of discrimination. So these came out in August. In May, so about 3 months before the guidelines, President Reagan made his first public speech about AIDS, and it was at Elizabeth Taylor's AMFAR Foundation. There was some sort of a benefit or whatever. And in going back again and doing research for our discussion today, I looked at some of the media around that and his actual speech. And he pretty much put out there that principle of voluntary, not mandated. There were still some unresolved issues about testing in the context of people applying for marriage licenses. But I thought it was remarkable that he came out with largely what would appear in the guidance. And I wondered, did you have any sort of a role in working with the White House to develop his speech, his remarks?
At CDC, we did not. I can't say for the Secretary's office, but I'm sure that that's what they would have put in if they were asked, but I'm not sure.
Okay. Because it struck me that it was rather curious. It was a good thing that
President Reagan was in the meeting when that was discussed.
Okay. So he had heard this from you and others about this principle of offer but don't mandate testing for the most part. Another sort of spin-off from this whole idea of HIV testing was where should people be tested? Because there was a lot of concern that people were going to utilize blood banks because the blood banks were obviously testing the blood supply. And so there was a real need to come up with a plan to direct people as to where they could find
To have
testing.
an alternative to having to go to the blood bank to know whether
Exactly.
you're HIV positive.
So that also fell to CDC to come up working with state and local health departments. This whole setup of, I think they were called alternate testing and counseling
Mhm.
sites.
That's right, because the blood bank was the only place you could do it, and you had
Mhm.
to donate blood if you did, and that's the last thing we wanted to have happen.
So that was another sort of revolutionary idea that took hold and was implemented during your time as CDC director. Are there any other guidelines or recommendations that stick out in your mind, or any other prominent battles that you recall?
Not a battle, but one that, in retrospect, is so obvious. When the AIDS epidemic broke out, it was only surgeons that used gloves in the medical care setting. And he used gloves not to protect himself, but to protect the patient from infection. But phlebotomists, nurses, giving injections, even dentists didn't glove when they provided dental care. And it was during the AIDS epidemic that universal blood precautions were introduced nationwide. And I think it's interesting that it took AIDS to get that across, because hepatitis B is probably, we use the figure, about 100 times more infectious than HIV. And yet we weren't using universal precautions, even with hepatitis B, but it took AIDS to get what is now standard medical care. I'm sure that we helped the glove industry tremendously as a result of that. But look at the number of hepatitis as well as AIDS infections we prevented. It's still spread if you get a needle prick injury and penetrates the glove, but that's rare compared to the kind of exposure to blood that a lot of medical personnel were having.
Absolutely. There were a whole series of healthcare setting recommendations that CDC developed over a long period of time, and as you say, the leading to this concept of universal precautions, that every patient should be viewed as being potentially infectious for HIV, hepatitis B, hence the battle days where it was kind of considered a badge of honor if you got a little blood splashed on you.
Even the police carry gloves. If there's blood, they put gloves on, and we've just changed the whole. And the only other thing, and it isn't controversial, but I'm proud of CDC because they stuck their neck out again and again on those guidelines. Many of them are controversial, but those guidelines have stood the test of time, because I don't know of one guideline that ever had to be significantly withdrawn, and I don't know of one guideline that ever was shown to be inappropriate. And they were cutting edge when they came out. Science prevailed, not politics.
Yeah, and that I wanted to ask you about that, because the CDC director or the Assistant Secretary for Health, they, in the context of guideline development, whenever, you sort of seem to be constantly navigating a fine line between the science and the politics of it. And you seem to find yourself in that position over and over again, walking this fine line of wanting the science to be correct, absolutely, but then the realities of the political context of the day. That must have been very challenging.
I think it is challenging, but it just gets back to the word trust. If you let everyone know that it's going to be science, not politics, not social custom, but I will be guided by science, then you have confidence in I think we can largely agree on science. Now, I think things have come where even science is debatable. It's more difficult today. But on the other hand, this whole relationship of trust, so that we were able to, even though it was a Republican election and president, and we had a Democratic Congress, and there was that feeling of trust. And so I think we were able to negotiate everything because it was based on science, and that was the only consideration. So both parties knew where we were coming from.
Well, before we close, I wanted to ask you just sort of a few questions that sort of reflecting back a bit. What are your insights now that we look back, 35, 40 years ago, about how CDC approached the AIDS epidemic? What do you think CDC did best? Were there things we could have done better?
You know, I'm the wrong person to answer that question because I was involved, but from the start with Bill Foege, who was CDC director when AIDS was first reported, through my period, those that followed me, you know, it always could have done better. But I think if there was a fault, it was probably communications between different parts of the public health service. I think CDC communicated well, and I don't know. That's a good question, and I just find it very difficult to find a lot of defects. Someone more objective should answer that question.
Well, what impact do you think AIDS had on CDC? Sometimes it's remarked that AIDS was sort of a turning point for the agency, that the agency became more politicized with the AIDS epidemic. Do you think it did have an impact on the agency?
I think AIDS had a big impact upon the agency because I think people knew about CDC before AIDS, but not well. And CDC, you talk about Surgeon General Koop. What do you hear about the Surgeon General today? Probably don't even know who the Surgeon General is. And CDC was not well recognized by the general public. I think state health departments and people that were in the field of science knew more about CDC than politicians and the general population. But CDC, because of the prominence of the AIDS epidemic, and CDC, I don't think most people think of NIH or FDA or any other part of the federal government when they consider AIDS. They think about CDC. So I think that AIDS allowed CDC to become politically visible, nationally visible, and I think people felt comfortable. They felt that CDC had responded well, and they thought if CDC can do that well with AIDS, we've got epidemics of chronic disease, injury problems, we've got toxicological problems. If CDC can handle AIDS that well, then maybe they can take on some other responsibilities and do just as well. So I think it just opened the door by giving us an opportunity to shine.
Let me ask you, what about the impact on you personally? In your job as CDC Director, Assistant Secretary for Health, your work was conducted under a lot of public scrutiny, political scrutiny, glare of the media. How did you handle that? How did you decompress from these kinds of, from a high pressure job like that?
Well, I wasn't totally successful. If you were to ask my wife, there was one evening when I punched a hole through the wall of my bedroom.
Literally?
Really. but that's the way I took it. No, it was a telephone call over the AIDS mail-out.
Oh.
Fighting with someone. But, you know, to me, it was a very interesting adventure. I enjoyed it. I most enjoyed the people. And not just at CDC, but the other agencies. As I left CDC, I don't know of a person that I didn't feel was a friend. I respected, I highly regarded them, I enjoyed working with them, and I guess if I learned anything during that period of time was how important other people are and how fun it is to work with them and get something accomplished. I also, I think, learned to appreciate people who suffer from health problems more than I had at any other part of medicine, as I saw people with AIDS and talked to people with AIDS and saw the discrimination and the difficulties they had. So I left that job with a better understanding of people who are ill or disadvantaged. So I think those were the two sides of it. It was my experience with people, and it was just a great experience.
Are there any closing thoughts, anything you want to add that we haven't covered?
No, I just thank you for giving me the opportunity to rattle on and express myself.
Well, we're delighted that you could be included in the oral history. As I said at the start of our discussion, you were in the hot seat. It was a very exciting time. Lots of things were happening, good and not so good, with the AIDS epidemic at the time. So I thank you very much for sharing your memories with us.
You're welcome.